COVID-19 created surge capacity challenges for most hospitals. What lessons can we apply to future facility planning so that we are better prepared?
We've known for a long time that flexibility is really important in the design of a healthcare facility, and that all the rooms need to be flexible so we can adjust as we need to, depending on the different types of patients that we need to see or just changing trends. One thing we haven't done is really provide that level of flexibility with the systems that support those rooms, such as the electrical system, the ventilation system, and the med gas system. And in cases where we have tried to do that, unfortunately, that often gets cut out at the last minute through budget cuts in the design process and don't actually ever get implemented into the project.
I think two changes that would be fairly easy to make that most of us will want to consider going forward are things like expanding our branch lines on the infrastructure. So our medical gases, our oxygen, and then also setting up our air handlers to be able to take HEPA filtration. So as an example, we had a number of nursing units that were able to support the additional beds required for a COVID cohort unit. But when you went back and calculated the size of the piping that was carrying the oxygen, it wasn't quite enough to do support the ventilators downstream. Most of them were, and certainly the inline pipes were fine, but the branch lines where they started to collect feeders probably need to be addressed. And it's worth looking at that early on because it's pennies on the dollar to upsize those a little bit during construction.
How do we improve on the things that affect our daily lives before the pandemic? So the epidemic of hospital-acquired infections, the endemic of surgical site infections. They now have operating rooms that are safer, cleaner, and have a much lower risk of developing a surgical site infection. And at the end of the day, the surgical site infection is costly to the healthcare system, but it's more costly to the patient and their families. And that's what we need to be thinking about. How do we take care of our patients? 1 in 25 people admitted to a hospital will acquire a hospital-acquired infection, and 1 in 9 of those people will die. That's a problem. That's where we were before the pandemic. Things that we can do to decrease hospital-acquired infections include not only the basic stuff that we do, hand washing, wearing gloves, wearing a mask, identifying people who are contagious and isolating them, but we need to do more because those things that we're doing now just get us to the 1 in 25 that obtain a hospital-acquired infection and the 1 in 9 that die from the infection. So one example would be to use dry hydrogen peroxide. That's a way to kill bacteria or kill viruses that exist in the air. It has been shown in hospitals that employ dry hydrogen peroxide that they decrease not only MRSA, they decrease C. difficile. They have less employee sick days. And one of the biggest things in this pandemic, our most important resource in the pandemic has been our healthcare workers.
It's important to remember that the physical environment itself is really an extension of the healthcare clinical team. We put a lot of environmental controls in place so that the clinical team can focus on the patient. And when we introduce anything new to that environment or that ecosystem, we can upset that balance very quickly. And so it's important that when we start bringing in new items or new ways of doing things, or even changing our processes in the way we deliver patient care, that you have a multidisciplinary team involved that includes the facilities team that understands how the building operates, works, and the details of that ecosystem so it doesn't get out of balance.
One of the things that's come out of this pandemic is a lot of great ideas on how we can manage our environment of care, how we can clean our facilities, how we can keep our systems infection-free. I would suggest that you very carefully follow the science. Pay attention to the epidemiological evidence that any vendor or these groups bring forward, these techniques bring forward. Pay attention to the clinical evidence, not just the white paper that has created a study or a relationship between cause and effect. Look for how these types of products have been used and how they have been, what their efficacy is in the field.
So in a crisis, we're all scrambling. We're trying to figure out how to do things. We realize that the space that we're using may not be appropriate for what we need it for. In our hospital facility, we had to double up patients on the COVID floor. We just didn't have enough rooms in the hospital that had the appropriate air exchanges to house these patients. There are companies out there that utilize cargo containers that act as clean hospital rooms, clean laboratories, and they can be mobilized in a moment's notice.
The use of modular construction or construction that is really built or fabricated offsite and brought together and actually assembled on site can really speed up the process of adding space to a hospital or rebuilding hospitals. And it's been very effective in many situations. Unfortunately, we've had to have that experience with hurricanes or tornadoes, such as the one that devastated Joplin, Missouri. They were able to use modular construction to basically reassemble a healthcare facility and to continue to serve their community, which was an extremely important endeavor.
One of the opportunities we have in hindsight, looking how COVID rolled out and what the surge was like, is to consider working with our communities about some of the civic spaces that are embedded in almost every community, from a civic center to a sports arena to a convention center, that are already set up and certainly capable of having the space to take on a surge capacity. Thinking about how a community or a regional government or a state government might partner with a company that makes modular care units that could then be brought in and placed and assembled in one of these facilities would quickly open surge capacity that's necessary, especially for lower acuity or even medium acuity patients. There's been many things that we've had to do through this pandemic that actually going forward make us more efficient. Telehealth is one that's talked about a lot, and using it to triage clinic visits, to make the visit to your physician more effective, to utilizing technology to create less wait times in an ER, as an example, or created distributed waiting opportunities so that patients can not have to be in a full waiting room. Those are just some basic elements that we'll be able to use going forward that I'm sure will get adapted and will change the way our healthcare system works going forward.
The return on investment of working on the physical environment is really, again, it's that extension of the clinical team. And the more you can provide updated technology in your healthcare facility and take advantage of all these new standards, the better service you can actually provide to your patients and the better environment you can provide for your entire clinical team.